but we can post them online for anyone who misses or is unable to attend one of the scheduled training sessions. Thanks, Ellen, for starting the recording. So just in terms of a little bit of housekeeping, so we are a small group, so we may be able to, if we stay this size, stop for questions along the way. But feel free to drop your questions in the chat, and my colleague Ellen will be able to respond to them while I'm going through the demo. So I'm going to switch over to the demo now. Okay. So as I mentioned, my name is Robin Stewart. Hopefully this is just popping up. Good. So my name is Robin Stewart, and I'll be your facilitator. The purpose of this session is to introduce you to COVax, the Salesforce application and its functionality, to introduce you to various user types in the system, and to provide a demonstration of the end-to-end flow of functionality. So if the group size does get much bigger, then we'll ask everybody to keep themselves on mute. But as long as the group stays small like this, feel free to raise your hand in the session, your virtual hand, and Ellen will let me know and we can stop and answer your question. Otherwise, you can put your questions into the chat. So what is the vaccine management system? It is designed to enable the capture of necessary data related to the immunization and vaccine inventory. And it's an application built in Salesforce, which is a case management software. And it will be eventually fully integrated with the case and contact management system, or CCM. COVax was originally released on December 15th as a minimum viable product. We piloted in 2 locations, and since then it has been released out to over 8,000 users across Ontario. We have had several new functionality releases, and we will continue to over the coming months. So certainly stay tuned to see any of the new enhancements that will be communicated to you by email and or through training materials. In this session, you'll be looking at the latest and greatest. So we will see functionality related to the bulk client upload, the vaccine inventory, clinical operations, and dashboards and reporting. This session is intended to give you a high-level overview, so it will be fairly quick, and we do have several more in-depth sessions based on the various roles that you will be performing. In terms of user support, we can offer a few things. So the ministry has set up a SharePoint site. Your PHU or site leads will be able to download from there comprehensive job aids, pre-recorded sessions, and other materials like templates that will be helpful for you. They can download those from the ministry SharePoint and put them in an accessible shared location that's accessible to your site team. We also provide office hours, which are interactive help sessions, so you can feel free to drop in any time between 11 and 12 daily to ask your questions to the training team. If you have other non-training related questions, you can contact the help desk for things such as assistance with access, passwords, reporting issues and defects, etc. So there are a couple phone lines and an email address, and those are available 7 days a week from 7 to 8, 7 a.m. to 8 p.m. In terms of system users, originally COVax was certainly designed to need to accommodate a clinical or hospital setup for mass vaccination. So you will hear reference to roles in the system such as check-in and check-out clinician, which is called a site staff, vaccine administrator, inventory administrator, and site super user. So these roles originally certainly did correspond with physical locations or set up in a clinic. Now, from a PHU and long-term care retirement home setup, you'll most likely be, you will not be a site staff. You will be one of these three roles. So at the PHU, you will likely have a public health unit inventory administrator who oversees inventory across the jurisdiction of the PHU. They might delegate inventory responsibilities to certain or all long-term care and retirement homes or clinics under their mandate, or they might take a more centralized approach, which we will talk more about in the inventory administration training. Likely at the PHU, there is a PHU site lead, somebody who can assist with bulk uploads of clients, but also that person can generate reports and data from COVax. You may also have super users at the long-term care or retirement homes who are uploading their own user or client lists, who might be administering inventory as well as administering the vaccine or doing data input. And then finally, you might have users at the long-term care and retirement homes who are specifically there to do vaccine administration. We call them vaccine administrators, and they can check in a client, administer the vaccine, and check out, but they cannot do inventory administration, uploading of client lists, or any of those other functions. So I'm going to go into multi-factor authentication. This is involved in the setup of your profile in COVax. So multi-factor authentication means that we need to take more than just a username and password. You will use a third method to authenticate, and that will be your cellular phone. So that it is important that you have at least 2 devices when you're using COVax. So you'll need to be using COVax on a tablet, a laptop, or a desktop, for example, with internet access. And you will need your mobile phone, which has to be a smartphone that can download the Salesforce Authenticator app free from any of the app stores. So the process starts with you receiving a welcome to Salesforce email. It will ask you to verify your account. This email will come to you once your site lead provides the list of users to the ministry, and the ministry can have them uploaded. That will generate an email that will be sent to you. That email link does expire within 24 hours. So if you have not received it, you may want to check your spam or junk mail just to make sure it hasn't gotten in there and potentially expired. Unfortunately, we can't tell you when you will receive that email, so please do contact your site lead for more information on when you should receive your Welcome to Salesforce email. If for some reason you didn't get that email or the link expires, you will have to contact the help desk, and they will send a password reset email. So in that password reset email, you'll see a very long hyperlink that you will click on, and that will allow you to verify your account. So these two, whichever method you take, you'll click on a link, and it will take you into COVax to a page with an acceptable use policy from the ministry. You'll read that policy and scroll all the way down. Once you have accepted the policy, you will be automatically directed to a page that looks like this one. It asks you to connect your Salesforce Authenticator. There are some instructions, and it asks for a 2-word phrase. So here you will need to type in a 2-word phrase. So where do I get my 2-word phrase, you might be asking? That's where your phone and the Salesforce Authenticator come into play. So once you have downloaded the Authenticator, excuse me, once you've downloaded the authenticator on your phone, it will ask you to allow it to send you notifications. It's very important that you do allow it to send you notifications. You'll need to receive a text message during this profile setup process. And every time you log into Salesforce or to COVax, you will need to approve the login using your phone. So it'll have to send you a notification. So please do allow notifications. Then it will direct you to enter your mobile phone. And it should go without saying that you should enter the mobile phone that you're using so that you can immediately receive a text message from Salesforce, and then open that text message and you'll find a hyperlink. So you should click on that hyperlink. And then it will ask you to set up a 4-digit passcode. So this passcode is intended in case you need to restore your account in the future. You would provide that passcode. So do keep it safe or commit it to memory. You'll input it once and then again a second time to make sure you've keyed it in correctly. And then it will confirm for you that your passcode has been created. So then you can go ahead and add an account. So if you're already a user of COVax and you have already set up an account in the past, then you will simply set up a new account. You will not have to download the app again. You'll see your other Salesforce account up here, and this button Add an Account will be slightly lower on your screen. So you'll click Add an Account. So if you have CCM, you will need to add a separate account for COVax. So you click on the Add an Account button, and that's where the 2-word phrase is generated. So in this case, the phrase is Ultimate Dark, and we go ahead and type in the browser window Ultimate Dark and click Accept. Once you have done that, it will prompt you to check your mobile device, and then it will ask you to confirm connecting the account. So you will click Connect, and then your account will be added successfully and confirmed here, green circle and check mark, and you can click Got It. Then the last step on your phone when you're creating your profile is to approve the login. So you'll click Approve, and then it will ask you to create or change a password. So you'll need to create a new password with at least 8 characters, of which 1 is a letter and 1 is a number. You'll input it twice to make sure you've keyed it correctly. And then you can select a security question and write in the answer and click Change Password. So once you've done all of that, you will be able to, or it will bring you into the COVax application. So you may be wondering, do I have to do that every time I log in? Now, fortunately, you don't. Once you've done that step and you've created your profile, you will simply use your username and password, click Login. If you don't know what your username is, of course, refer back to your email from Salesforce. It will tell you what it is. For most of you, it's your email address with .covaxon on the end of it. But do please check your email to confirm. Once you've put those 2 in, it will ask you to check your mobile device. And then it will ask you on your phone to approve the login. And then you can click Approve. So I'll pause there just to see if there are any questions about authentication in COVax.
Robin, there's one quick question from Laura. She's wondering if the password is case sensitive.
So the password, it is case sensitive, but there's not a requirement to put a capital or a lowercase letter.
Great. No more questions in the chat so far.
Great. Thanks, Helen. Okay, so now I am in COVax. So here you will see the COVax screen. I've landed on the client search tab, which is what I would recommend you add when you save or bookmark the link. I would save this link so it lands you in the client search tab. Now, if you're the inventory administrator, you might want to focus on one of the two tabs you'll be working with. These three first tabs relate to the function of the inventory administrator, the vaccine administrator, who can see client search, clients, and dashboards. The inventory administrator can see these three tabs plus shipment and inventory. And then the site super user can see the reports, providers, and mass data loads. They can see most of these other tabs except for dashboards. So one of the first things I would highly recommend you do is you check your profile to make sure you're set up to the correct service delivery location. That is essentially or especially important if you are a healthcare worker who is changing locations frequently. So here you would go to your little avatar, go to the avatar again, and that will take you to your profile. It essentially opens up this tab with your name on it and allows you to check out your profile. So here you can see I'm set up to the service delivery of Wellington Dufferin Guelph Public Health. And if I needed to change that, I can by clicking edit and changing this. So when we go into COVax, there are a few things that do need to be set up ahead of time before you can start a mass immunization clinic. So a few of those things, or the four of those things that you'll need to know are, first of all, users. So all of the COVax users need to be added by the Ministry of Health before, of course, you can use COVax. So your site super user or site lead will need to provide that list to the ministry to do an upload. The second thing is the bulk client lists. So we will upload client lists of eligible vaccination candidates into the system using the mass data loads, which I will show you in a minute. The third thing is that your site super user will have to make sure to provide all of the providers in a list to the Ministry of Health so they can input those. The providers are anybody who will be administering a vaccine, whose name has to be able to be displayed on the immunization record. And lastly, the inventory administrator will need to input inventory. So we have two types of inventory records, a shipment and an inventory, which I will show you shortly, which will need to be input before a clinic can start. So I'm going to start by showing you a mass data load. So really quickly, because there is a separate training session on this, 4 p.m. daily. When I go to the Mass Data Loads tab, I'm able to see a list view here that I can change. So in Salesforce, these views here are called list views, and this is your list. This is a list of number of recently viewed mass data loads. Most of these are mass data loads that I have done, for example. So to do a new mass data load, I will have to click New. And then I can open the record here and select the type of data load. So in this case, we'll select client and we'll select client data insert. So those are the only type of mass data loads we can currently do. So this will then give me a set of instructions and a client data insert template. I'm just going to make sure I don't already have one open. Good. So I will go to COVax, download the client data insert. It will open for me here. That's not it. That's my client list. It will open for me here. So it's a fairly simple blank template that I will save into my downloads. So this is version 36 for me. I will replace it. You'll need to make sure that this bar goes away, and then you can use this template. So you may be wondering, do I build my client list in this template? And you will not. The ministry has created another template. It's called the client's load template that you'll use. You will want to check the version to make sure you have an up-to-date or current version of this template. I think we're actually around version 38 right now. The main changes in all of those versions are the defaults set up. So as we roll out to new service delivery locations and organizations, for example, they need to be set up in the defaults. So if you have a template that's slightly old, as long as your defaults are there, that should be fine. But we do recommend you check for the newest version. So in this client loads template, there's a tab with a set of instructions that will help you use this file on the bulk data upload. There's a tab called Data Elements, which will help to inform you about each of the different data fields. There are the defaults here. So if I, for example, want to set up, we did yesterday, Thunder Bay, for example, I'll start searching Thunder, and then my defaults show here, for example. I can also default, for example, for residents of long-term care retirement homes, I can default the residents to have all the same address, for example. So for long-term care residents and staff or caregivers, you will want to make separate lists for the residents so that you can take advantage of the defaults, and have another list with staff and caregivers so that you can put their actual mailing address in there. On the fourth tab, there is the client list. And on the fifth tab, there's a validation tab that lets you see if you are missing any mandatory fields, for example. So I'm just going to quickly make a little change to this because I've used these numbers already. So let us just update this to, I need to not duplicate all my users. Oh, apologies. Okay, so when I'm doing an upload, then what I will have to do is copy these people's names and paste them into my file here. So I'll click V. Now you will see the new folks are input into the client data insert, and we can continue with the upload. So I will find my downloads folder where I've saved it, click open the file 36, and then it will allow me to submit, and I'll say okay. The file has been uploaded successfully, and I can click okay. And then I'll get a report that indicates how many of my clients were uploaded successfully. Interestingly, it indicates that none of them were uploaded. So if I need to, I would have to check the error file. So it's probably because I'm using an older template. So we'll see if we can find my clients when we get there. Let's see. So That's a mass data load. So that's how you upload your client list. If you have any issues doing that, of course, you can contact the help desk. We do have a detailed training to assist you in troubleshooting at 4 o'clock daily. So please feel free, if you're a site super user that needs to do a mass data load, you'll be able to do that. The next thing I'm going to show you is shipment and inventory. So these are the responsibility of the inventory administrator. We have an inventory administration training, of course, again, also daily, where we instruct inventory administrators on how to administer inventory in COVax. So again, when you go to the shipment tab, you can see the list view. It usually defaults to recently viewed, so I can also view shipments by different statuses. Here is my list, of course, of the various shipments. And if I need to create a new shipment, I click New, and I open up a new shipment form. So in here, I would create my shipment by adding my service delivery location, my product, the quantity received, the temperature from the temperature readers, etc., the status of the shipment, and the requisition ID, the total shipped, which should be the same as received unless there were any damaged quantity, and we would indicate the damaged reason. So shipment is created when the federal government delivers inventory to a hub location. So the hub location is a public health unit or a hospital that is set up with the vaccine storage equipment, so freezers and refrigerators, to be able to receive the vaccine. So the shipment needs to be created only by the hub location. So I'm going to open up a shipment that's already created. So this is a shipment I created the other day. So here I am, Wellington Dufferin Guelph. Here we received a total of 4,500 doses. Please note that in COVax, all inventory is measured in doses and not vials. And we use the assumption that there are 10 doses of Moderna in each vial and 5 doses of Pfizer in each vial, as per the current labeling. So here you can see we did have a damaged quantity and a difference between the amount shipped and received, and a damaged reason called damaged product. So once the inventory administrator creates the shipment, they will also have to create the inventory, because the shipment is not enough information to manage the inventory from. So we create a new inventory record by clicking the New Inventory button. We pop open a new inventory screen like this, and we fill in the information of the inventory. So I'm going to open one that's already been created. So I'm going to open this one. And here you'll see an inventory record is made up of an asset name. So we do have a very important naming convention, which you will see becomes relevant when we go to administer the vaccine. But the naming convention is the root product. So that should be the same as the product here. So COVID-19 Moderna vaccine, MOD.0.5 milliliters, which is the dosage. Then we have the lot number, which should be demonstrated here is the lot number. And then we have the expiration date. And this information allows the vaccine administrator to select the correct inventory to put on the the vaccination record. So when we look down at the inventory record, you can also see a few other things. So it's connected to my service delivery location. We have a storage location. We can also create storage locations in COVax. So if I needed to change this, for example, I could remove it from fridge 1 and I can add a new storage location. So I'll just pop that screen open so you can see it. And you can see that there are various storage types that can be used here in COVax. So I'm going to return this to the WDG fridge 4 that it was in. Great. As we go down in the record, there is the dose information. So this total number of doses, 2,000, was how much was originally in the record. As the vaccine gets to be administered, this number here, doses administered, goes up, and the number of doses available, as indicated here and here, those will auto-decrement as the inventory is used. A few other things that, of course, will affect the inventory is returning doses, wasting doses, wasted due to excursion events, relocated doses, and shipment incidents. So if any of those happen, those numbers will change and they will auto-decrement from the inventory. And then finally, you'll see down here whether there have been any recall events. And that is the inventory record. It's beneficial to note, of course, that there is an asset history here, so that any changes made to this asset record will be tracked here in the asset history and is auditable. So in the inventory administration training, we do train users on how to use the transfer doses screen, which I will just pop open. So you'll see transfer doses. So you just need to select a location to transfer them and the total number of doses. We teach people how to accept inventory, which they can do by going to the inventory tab and finding pending transfer inventory and then accepting it using the accept button. And we teach people how to do a recall on inventory. So I'll just pop open the recall screen. So it's simply to record the source of the recall and the recall date, and that will recall this whole record, and it will update this section down here to indicate that there was a recall. The recall can also be rescinded, and we teach people in the inventory session how to rescind recall as well. We also teach people how to create wastage events. So an excursion event is an event related to a temperature excursion. So that's where a freezer or fridge malfunctions, or the power goes out or something like that. And an assessment of the viability of the vaccine needs to be undertaken by the public health unit. So we teach users in the session how to create a new excursion event. Oops, I have to, that's okay. Leave this page. Good. So here is the form for creating an excursion event. For anyone who is familiar with managing inventory at the hub locations that have fridges and freezers, this form should look familiar to forms on the form repository at the public health unit. And we do go into detail in the training on this and have a job aid to support the filling out of an excursion event. We also have wastage event, which covers other types of wastage, which are typically more relevant at the clinic level or the vaccination clinic level. So here we have things like insufficient doses extracted from a single or multi-dose vial, unused pre-drawn syringes, some, storage issues, etc. So This is another type of wastage event, which we teach people how to use in the inventory administration training. And then the final thing we teach in inventory administration is a manual adjustment to the record. So there are two reasons you might need to manually adjust the quantity of vaccine available. And that is, first of all, when there are extra doses extracted from the vials. So if we had 2,000 doses here and we extracted, for example, an extra 100 doses out of all of those vials, then we would need to indicate that there was an adjustment reason, so a quantity adjustment. We'd indicate an adjustment note, so 100 extra doses, and then we would add 100 to the total doses here and click save. And that will update the number of total doses available. We should also, of course, put the date on it. So I'll adjust that as today. The other thing that you might need to manually record is when somebody gets the vaccine, but they do not consent to digital data collection. So instead of registering them in COVax, the ministry has created this paper form, which will be required for anybody who does not consent to having their information collected in COVax. And when you fill this in, for example, if somebody does not consent, so this will be left blank, indicating that they do not consent to data collection. We will need to manually adjust the amount of inventory down to reflect that those doses have been used. So for example, if for today, 2 non-consents, so 2 people did not consent, then we will have to subtract, for example, 2 doses and make that 2,098 and click save. So do remember that every time those adjustments or anything is changed in the record, you'll be able to see the change in the asset history. So that is a little bit about managing inventory in COVax. I'll just pause there to see if anybody has any questions on inventory. No? Okay, then we will proceed. So just to recap, before a mass vaccination clinic can start, we need to make sure that 4 things are input into the system. The users, which will be uploaded by the ministry and provided by the site lead to the ministry. The client lists, which will be done by the site super user via the mass data load. The provider list, which will be supplied by the site lead to the Ministry of Health. And then the inventory administrator will input the shipment and inventory as required. So once all of those things are in the system, we can get started with the mass immunization clinic. So I'll go to the client search tab. I like to think of this tab as a home page or a home tab for the clinicians or the vaccine administrators. This is the tab where we will find our clients. And so I'm going to start a search. There are a few search parameters here. I highly recommend that you use the global search at the top. And if necessary, you can augment your search with one of these 13 other search parameters. So I'm going to look up John Legend in here and see if my upload actually worked. Nope. And it probably did not. Okay, well, we might have to show you how to create a new record. But for now, I'm going to show you how to search. So I'm going to use Frank Chen as my example. So if I'm searching a Frank Chen, I put his name in the global search and I click search. and then you'll be able to see Frank Chen here below. If there were many Frank Chens in the system, you would see many names here, and you'd want to differentiate using their health card, their date of birth, and any other information provided about them. If it was a less common name, you should probably just find a few records. The main challenge, and why we really do encourage people to make sure the bulk upload has as much information as possible, is when we don't have something like a health card or birth date, it can be challenging to identify the unique Frank Chen, for example. So I'll show you an example of John Smith. I think we have a few of those in here, for example. Click search. So you'll see we have 8 John Smiths. And so this is where you can see that having a health card number, a date of birth, phone numbers, or mailing addresses really does help us find the correct John Smith much easier. So where somebody has potentially or where you have difficulty finding somebody, I do recommend that you use their health card number, if they present with it, to see if there's anyone in the system with that name. So here we have a John L. Smith. That helps me narrow it down. But sometimes if a user has an alias or a different given or legal name, then you may want to search using their health card number if you're having difficulty finding them. So of course, you can use these other parameters. So I'm going to, for example, show you using this and put maybe Smith, and John should return us the same result. Search. Maybe because I didn't have the search. Well, then the other alternative is it's John without an H. No, that's interesting. Well, so these 13 parameters, and why I recommend we don't use them, is they can be finicky, but generally speaking, they do work. But they do have to be complete and accurate. So in this case, it's because his name was Smith John, not John Smith. See, I misread that. So now we can find it. So you do have to make sure that you use these correct and accurately. So I can put his name backwards in here and it would have worked. But in the other parameters, it would not. So the global search certainly is the most forgiving, and I'd highly recommend you use that. So if we are unable to find a client and we need to create a new client, we could do that creating a new client using the new client button. And I will quickly do this since my bulk upload didn't work. I'm going to create a Mr. John Legend. I'm going to give him a slightly different health card number because you cannot duplicate any health card numbers in the system. Please note that the health card is 10 digits long and does not include the 2-digit verification code. Note that if the user or client does not, have a health card number, we can accept certain alternate IDs. Where, for example, if they were a healthcare worker from outside of the province, like Quebec, working in Ottawa, we could put, for example, their Quebec health card number here as an alternate. I might just do for Don Legend, put an date of birth. You'll want to manipulate first the date so that you get the right date, for example. And then you do the month and the day. I'll pick male. There is a field for reason for the vaccine was not administered, which we will not use right now, but becomes relevant if the client does not get immunized. I'll put him at my location, Wellington, Dufferin, Guelph. Will indicate that he's a health worker. There are a number of different priority groups that are in this current cohort that you can select from. I'm going to indicate perhaps that he's a long-term care, healthcare worker in long-term care, and that he works for the, for example, Elliott Community Home. And we do not need to set a public health unit because in the real live environment, this will be auto-populated by his postal code. Here in the training environment, it does not do that. So here we'll want to make sure we do add a mailing address. So I'm going to indicate that he lives at, let's say 175 Metcalf Street in Guelph. And then it will auto-populate using Google. So it's based on this postal code that this public health unit field will be auto-populated in the real life environment. If the client is a long-term care resident and they have a proxy who's potentially providing consent on their behalf, you'll want to input their proxy name, their relationship to the client, and their phone number of the proxy. The email address, in this case, I'll put johnlegend@gmail.com for his own email address. But you can also decide if that should go to the proxy, if the proxy decides they want email proof of vaccination receipt. Or in some cases, homes have decided that they would put an administrative email here, so something like admin@theelliottcommunity.com, so that somebody at the long-term care or retirement home could actually receive the proof of vaccination receipt and then decide whether to forward it on to the proxy, to print it out for their files, or anything else they might need to do. I'll also put his phone number in, for example. And then we have enough contact information for him. So we do not need to put an email address, but without an email address, it will not be possible to email a proof of vaccination receipt. And then finally, at the bottom, there is consent information. So when we create a client like this, we likely do not need to have any of this filled out. This will be filled out during the check-in process. But this section allows for us to bulk upload consent information. For example, where in long-term care and retirement homes, prior consent is provided through a consent form, and that information can be provided in the fields here in your client list related to consent. So in these cases, true means consent. So these clients have consented to data capture and consented to email communication. So I'm going to save Mr. Legend's profile. And now you can see his profile is set up. Because we just completed it, we know that it is complete. If I had pulled this up in my search, the first action I would take is to make sure that we review it for completeness. And then we can proceed to check him in. So before we check him in, I will just point out that in COVax, you would see this is a status bar, and each client profile is a case. So like I said, Salesforce is a case management software, and each case has a set of case statuses and a case status bar. If everybody would keep themselves on mute, that would be great. Thank you. So in this case, this client will go from the status new. We will bypass first dose scheduled because currently there's not scheduling capability in COVax. It is coming soon, so we will soon use that status, but we'll bypass that and go to first dose checked in, first dose administered, and then first dose checked out. So you'll notice that that corresponds with these action buttons here at the top right corner, check in, administer dose, and check out. And if you were set up in a hospital or clinic, it might correspond with the stations set up in the clinic as well. For long-term care, we will often find that the same person will be checking the client in and administering the dose. They might also wait 15 minutes with the client and check them out after monitoring them for APHE. Or you might set up where you have another person who is set up in COVax monitoring APHE and then checking the clients out after they have been monitored. So I'm going to proceed to check this client in. So you will see on the check-in screen that it starts with an acknowledgement of collection, use, and disclosure of personal health information. So if the client is consenting here, you will read out loud for them this statement from the ministry, and you will obtain their consent for data collection, which you will document here with a check mark. Prior to capturing their consent, of course, we hope during the initial check-in process, as you meet the client, they provide some kind of identification, hopefully their health card, something like that. Prior to doing that stuff, you should have conducted some kind of COVID-19 pre-screening assessment. That, of course, might look different with residents of a long-term care or retirement home. But the ministry would like to know that there is something that has been done regarding COVID-19 assessment to minimize the risk of infection or transmission at the site of the vaccination clinic. So please do check this box, check consent to data collection. If the client does not consent to data collection, remember there is this data entry form, we call it, but it would not be data entered into COVax in this case, where you would leave the consent to data collection blank here in the consent section, but you'll fill out the rest of this, and you can manually create a proof of vaccination receipt and separate this from the paper and provide it to the client. So it is necessary to capture that information. It will just not be entered into COVax. So if you do not get consent, you of course would not check this box and you'd leave this screen and proceed with the paper form. But we have consent, so we're going to proceed. There's another statement here about consent to receiving follow-up communications. So they can receive communications by email or text and SMS. It is important that we check the box for email if they want to receive a proof of vaccination receipt by email. There's also a statement on consent to being contacted about research studies. So they will receive an email about research study or an information about research study right away. So they will need to decide which way they would like to receive that if they consent at all. So let's say by email, for example. And then we can click next. So now they're checked in. You will see that their status changes to first dose checked in. And now we can proceed to administer the dose. So at this point, we need to decide on which vaccine. So this will be subject to, of course, what their appointment says, what location you're at, and what inventory you have. But we're going to say that we have Moderna. So I'm going to select search Moderna. When I click on this field, it does automatically show me my recents at this location. I've been doing this in training environment a lot, so it will show me many. And here in the training environment, we have a lot of people adding inventory. So you'll see a lot more inventory than you will normally in a real life scenario. But I'm going to select this one here, lot number 10001 with the expiration date of May 31st. And I'm selecting that because that's what is written on the labeling of my vaccine. So this is why it's important to have the correct naming convention on the inventory so that it's easy for me to select the correct vaccine, lot number, and expiration date combination. Now I will arrive at the vaccine pre-screening assessment. For Moderna and Pfizer, they are both the same. They are a questionnaire about a number of contraindications related to the vaccine. And if you have received, or if the client mentions that they have any of these contraindications, of course, then you would check any boxes as relevant. If, for example, you have a consent form from a proxy because your client is not able to consent on their own, the consent form should include all of these questions as well. And if the consent form checks any of the boxes, we'd like you to check the boxes in COVax as well. At the end of this questionnaire, you do need to select the one mandatory field is that pre-screening assessment is complete, and then that will allow us to proceed. If there is a contraindication, for example, maybe a bleeding disorder or something like that, please note that the system will not prevent you from proceeding. It cannot make a clinical decision for you. So you will need to refer to the manufacturer guidance and use your clinical discretion regarding the safety of administering that vaccine. If there are contraindications that make you decide not to go forward, that's where, back on the profile, we have a reason for vaccine not being administered on the profile. So you would leave this screen by Xing out of it and indicate a reason the vaccine was not administered. We go into more detail on that in the clinical flow training. So I will proceed. So now we obtain verbal consent for service. We do not need to select a diluent because Moderna does not have a diluent, but Pfizer does. So if you're using Pfizer, you'd select a diluent. The route is intermuscular. It's already preset. You'll select your anatomical site. The date and time defaults to the time that I opened this page. The reason for immunization comes from the profile. And if we do change it here, for example, then it will be changed on the profile as well. And you have to indicate who the vaccine was administered by. So I can search my name, for example, and click enter, and it will pop up my provider number and I can select it. Of course, for me, since I've done this a lot, it shows me the recent providers. So I can also select the name of a different provider if, for example, I'm a data entry person entering this data. And I select next. Now you'll see the dose information. This information will go onto the proof of vaccination receipt. So you'll want to make sure it's all correct. If not, you can click previous. Otherwise, you'll click next to proceed. And now the dose is recorded. You'll see the first dose administered status change, and you'll see that this dose administration record has been created. So now the client should wait for their 15 minutes, be observed for any AFI, and then they can be checked out. So if I am the vaccine administrator, I may move on to vaccinate other clients. I might have somebody else helping to observe for any AFI. And that person who observes for AFI will also check the client out. So if that's the case, I will want to go to the clients tab if I'm trying to check them out, I will go to clients that are in the status dose administered, and I will see all the clients who are in the status of the kind of in the virtual APHI waiting room. So I can see my client here, John Legend. I could also, for example, put a search. So Legend, for example, enter, and that will help narrow it down. So I'll pick him up and I'll proceed to check him out. So there are just 2 questions on the checkout screen. The first is about APHI, or adverse events following immunization. So please note that there's no APHI reporting in COVax other than this little checkbox, which means yes or no. So it is important that we follow the current status quo process for APHI reporting with public health. So you'll want to have APHI reporting forms on site to be able to do that. And if you fill in an APHI reporting form for public health for it, you will check this box for it. If not, you will leave this blank, indicating that there is no APHI. And then the last question is about emailing the receipt to the client. So if the client indicated that they want to receive the receipt by email, you can check this box. And you will only have this option if they've both provided an email address and provided consent to follow-up communication by email. Otherwise, you will not see this. Then I highly urge you to go bypass this click here to view receipt. That takes you down a bit of a rabbit hole. So you'll click next. You'll view that the status changes to checked out, and you'll see a file created here, and that is the proof of vaccination receipt. So you can now download and click print on that. And you'll see at the very bottom of it, there's a blank line where you can handwrite in the time and date of the second dose appointment. And that is the clinical flow part of COVax. So the last thing I just want to show you quickly is the dashboard tab. So for all users other than the site super user, the site super user has the reports tab. You can go into your dashboards tab. It defaults to recent, so you'll need to go to all dashboards to find your location dashboard. And I'll show you the Toronto one because it has the most data in it in the training environment. So the dashboard here is a series of charts that provide you information about the inventory and the doses administered. And if you need to see more information, you can click in to view the report, and it will give you more detailed information about the data behind the report or the chart. It's just taking a minute. So this is, for example, the doses administered by day in Toronto, and you can see a breakdown of each day. And this is each one of the dose administration records for the day, for example. And so that is COVax at a high level. As we mentioned, we have other training sessions. We have the clinical flow training starting at 2 o'clock. We have the mass data load training and the inventory administrator training starting later this afternoon as well. And please feel free to view any of these pre-recorded videos, our job aids that can be accessed on the ministry SharePoint by your site lead, as well as office hours daily, 11 to 12. Thanks to everyone for your participation, and good luck in your vaccination clinics. Yes, and thanks, Ellen. We do have a feedback survey. If you'd be so kind as to take 5 minutes to fill out the survey that Ellen just put into the chat, we would really appreciate it. Thank you very much.